So treating TMJ patients, bruxism or grinding, we found a lot of correlation between the bruxism and sleep apnea. So if that's ruled out, we have certain appliances where if you're grinding your teeth, there's a full arch, half arch, whatever's more compliant with the patient that will wear it to really help them not grind at night, be a little less stressed out, and not put the tightness on their muscles. If in fact you do have some sleep apnea, also in that fact, there's an appliance that will help benefit your airway and also take care of the bruxism also. For our sleep apnea patients, if it's mostly common if a husband or a wife says, you snore a lot, let's get to the bottom of this. They come in with a snore complaint. Usually our first option is we work in combination with a sleep doctor, sleep test center, where it's an easy call. They send you a monitor, a few days of sleeping with this machine, strapped around your chest. Those results go back to the sleep doctor, sleep study. They'll go over these results. If you're in the case where you're more moderate, mild, severe, it's kind of the 3 targets that they give you. If you're in that mild, moderate, that's where we come in. Sleep appliance, you go through a couple impressions. We move your bottom jaw forward. That lets the airflow go in, stops the snoring, stops you from grinding your teeth also, and overall takes care of that sleep apnea, the mild, moderate. If you're severe, that's when you go into the CPAP, where the pressure of the air is flown in through the machine. So sleep apnea is becoming more prevalent, or more diagnosed at least. It's very important that, if you're stopping breathing during the night, that also contributes to, heart disease, other situations that are really serious. And we want to get that taken care of and add years to your life.